Okay. Okay. What is that? Okay.
I'm going to jump at the back of the room. Enjoy.
Okay. Thank you. Hello, everyone. Myself is Alok Vyas, and I am a spine patient. I broke my neck, and I became paralyzed some time back, and because of that, uh, the life has become very troublesome. And so I decided to, create some some content which I have collected over the time with my experience by reading various places and all. And today I'm going to present all those things in front of you, so all of you also get aware. Okay. Um, so today, guys, everyone, we are going to learn about the spinal cord injury, and I hope that I will be able to present it in the best manner I can. At any time, if you have any question or any doubt, please note it down. I will take all of those at the end in the question answer session. Okay, so let's start. Can you press page down? Page, press page down. Number 3. Yeah. Hello, guys. So let me start with the main objective of this training. Everyone can see the screen, right? And everyone can hear me, I hope. If anyone having the problem in hearing me, please let me know, okay? So, so to start with, the main objective of my training is, first one is to spread the awareness about spinal cord injury so that more and more people can be saved from getting into this horrible life. Because if you are not aware, then you also can do some mistakes which are obvious, and we don't think about it, and we do those mistakes. So after having the know-how of the spinal cord injury, this training, I am sure that you will be able to not only save yourself, but you will be able to save the people around you also. The second objective of this training is to provide as much information as possible in the minimum time and in an organized way at a single place, so that those who are already having the spinal cord injury can be benefited with the knowledge of multiple things which can help them in living their life in a better and easier way. Third will be the third objective of this training is to make the caregivers and the family members who take care of the spinal people, to make them aware of everything from basics to as much complex information as possible, so that they can take care of SCI patients in a more easier and efficient manner. You can see there, like you can see the screen if you want. So, so these are the three objectives with which I am presenting this training to all of you, and I hope that I will be able to do justice with it. Before I start, let me tell you, all of you, that after this presentation, I will be giving you an assessment questionnaire which you need to answer and submit. That way, I will be able to know how much you have understood and what all knowledge you gain out of this training. So please concentrate and try to grasp as much knowledge as possible out of this training. Okay, so let's go on the next slide. Yeah, so to start with, as you can see in this training, I have divided this training into two halves. In the first half, I will be telling about what is spinal cord injury, the key facts about it, what are the symptoms which tells you whether the person has got spinal injury or not, what are different levels of spinal injury, what all different extent of lesion. Lesion means the injury, the wound which you got through the injury. So what extent of the wound which you have got on the spinal injury, what is flexion injury, and what is the vertical compression which you get and in the spinal cord injury. Next, we will be discussing about causes of spinal cord injury so that everyone should be aware of what all are the main causes, and once you are aware of the causes, you will be able to save not on your life, on your own life, but you will be able to save the life of the people around you. uh, you know, and then I will be talking about what all the major risks involved with the spinal cord injury patient. I will be discussing little detail about the autonomic dysreflexia, which is also a major risk, which is one of the risks. Okay, there are many other risks also, but autonomic dysreflexia is one risk, and I will be explaining that also in detail. Lastly, I will discuss about how we can prevent the spinal cord injury. So all this I will be talking in the first half. We will take a 5 minutes break. Depending on the time it took in the first half, we'll take 5 or 10 minutes break. Then I will cover the second half, in which we will be talking about like even after all the precautions and things, if someone gets the spinal cord injury, then how they can live their life, how still they can live their life. I will discuss about the important aspects which needs to be dealt after the spinal cord injury. I will i will talk about like how the patient themselves can help and stay motivated. I'll be talking about various other ways in which the others means, can you click on deny. Sorry for that. So guys, please don't ask for recording. I am recording it, and later I will try to share with every one of you. So please don't send any recording requests. And then, so later, to continue with what I was saying, we will be talking about various other ways in which every other people, like family members or carer, they can help the STI patient in like, getting various things done, which uh, which can make it possible. Okay, the other things which I will be talking about is the assistive technologies which are there, and which are helping the spinal cord people in various way, and enabling them to do the things which they are not able to do after the spinal cord injury. Later, I will be talking about what all research and development are going on throughout the world to improve the condition of the spinal cord people and to make them enable. I will be showing some of the resources from where you can get the information about what all things are going on in the world, what all research is going on, what all various places from where you can get more information, and then similar things. And at the end, I will be discussing about what are the qualities uh, which should be present in the carer or the patient, if so that they can be called as expert carers. So the expert carers or expert patient are those who are aware of as many things possible about the problem which they are facing, in this case about the spinal cord injury. And then I will be sharing the contact details for further if anyone wants more questions to ask after the training. and lastly we will be doing the question and answer session. So in between all this, if anyone have any questions or doubt, please note them down. I will be taking all of them and we'll try to answer all of them. Can we go to next page, please? No, next page. No, go up. Yeah, next page. No, number 3. Okay. So to start with, uh, be, before we talk about spinal cord injury, I would like you, I would like to discuss about the basic, like what is spine, what is spine cord, and what is spinal cord injury. So as you can read, the spine is one of the longest structure which is made of 33 bones. Okay, and these spinal columns provide the main support for our body, allowing us to stand up, bend, and twist while protecting the spinal cord within the from the injury. So spine is like you can call it the bony structure in which the spinal cord resides. Okay, the first picture shows you the picture of the spine. Okay, now coming to the spinal cord, it is a network of nerves, okay, which are responsible for sending the message from the brain to all parts of the body and vice versa for controlling all the movements and sensation in our body. So as you can see in the second picture, there are veins, there are nerves which goes from brain to all different parts of the body, and these are the nerves, these are the which we call the spinal cord. And the thing what happens is, because of these nerves only, we are able to know and we are able to sense and the uh, different sensation and movement in our body. For example, if you touch your finger to the any hot thing, then what happens? Immediately your the signal goes to the brain, and brain immediately send the signal back saying that take your finger away, otherwise it will be burned. So this message from the finger goes to the brain, and immediately brain sends the single signal to take the finger away. So this is the way it all functions, and this is the way the spinal cord works. Okay, now what is spinal cord injury? So what happens is, because of anything like accidents and other things, if you break this spinal cord from any level, then this the communication between the brain and the body gets disrupted, and because of that, the signal from the brain will not go to the body which is below the level of injury. I will show you more pictures about the levels and all in the coming slide, but just remember that when a spinal cord is broken at any level, the all the sensation and movement below that level will go away, because the brain is not able to communicate with the body which is below the spinal cord injury. Okay, can we go to the next slide, please? Okay. So in this one, I want to share some key facts about the spinal cord injury. So every year around the world, between 250,000 to 500,000 people suffer with the spinal cord injury. And the most important, most of the spinal cord injury are preventable, like they happen because of the things which we are not aware of, and those can be prevented if we have the knowledge of it. And such as like road traffic crashes, fall from the building, or any kind of violence. So all these can be prevented, but these things happen. And the third thing is, spinal cord injury affects more men than the women, and the reason is obvious, because in most of the cases, it's the male people who take more risk, and because of that, they get more spinal cord injury than the female part of them. And it's usually, it has been seen that it happens between for the people between the age of 16 and 30, because they are in, like, uh, teenage, you can call it, or they are in the energetic mode all the time, and they take the kind of risk which ultimately ends into the spinal cord injury. Fourth fact is this, that the mortality risk is highest in the first year. So if anyone gets the spinal cord injury, chances of him or her passing out is very high in the first year. If they survive the first year, then their chances of surviving for longer time is higher. And even when I say higher, it is not like it is not equal to the normal person. Most of the cases, around the, like, 2 to 5 times, there are chances that the person with the spinal cord injury will die before the normal person of the same kind. Okay, so these are the key facts, and everyone should know about it. Uh, Next, can we go to the next slide, please? Now, coming to the symptoms. So, how will you know? Like, let's say someone met an accident, and how will you know that whether he has got the spinal injury or not? So, they check the symptoms. You need to check the symptoms. So if you see that the person has loss of movement, I mean, like, he is not able to do any movement in his limbs, or whether it can be just legs, or maybe the hand and all. So if the person has loss of movement, then it tells that, oh, looks like he has got spinal cord injury. Similarly, there is a loss of sensation, like they don't feel heat, cold, or anything, then that also indicate that he or she has got spinal cord injury. And the loss of bowel and bladder control. So uh, whosoever gets spinal cord injury, the first thing which happens to them is they lose the control over the bowel and bladder. That means, like, they are not able to urinate or pass the stool on their own. They don't have any control on that, and they will need someone to help them to urinate and to take the bowels out. We'll talk about it in more detail later. Third thing, symptoms are that they get spasms. Spasms, you can call it as the involuntary movement, something like, their legs or their body starts shaking, irrespective of the fact that the person is not moving the legs, but it's involuntary movement, and that involuntary movement is termed as the spasms. So that also is indicate that person has got something wrong. Next one is, like, once the someone gets the spinal cord injury, they don't feel like they don't they lose their function of sexuality, and the sensitivity in their sexual organs, and they don't feel the same pleasure that they used to before the spinal cord injury. It affects their fertility rates also, but still, I can say that it's not that they cannot produce child. There are ways in which the doctors can help the spinal patient, and through which you still can have the babies. So that's another thing, like, it disturbs the sexual function and decrease the fertility rate. Another symptoms are that the spinal people get pain or intense like sensation. For example, I am also a spinal patient. I am I have broken my neck in an accident, and I always feel pain in my shoulder and neck because I have sensation only till that area. So whatever pain, I don't feel pain in the rest of part of the body below my injury, but wherever like on the top, I feel pain. And by intense changing sensation, I mean like we feel many different kind of things. Like sometimes we feel that thousands of ants are running all over our body. There is nothing running on that, but we feel that sensation, and it's very, very disturbing. So these are some of the things which are out of control but are really disturbing to the patient. So if someone is feeling pain and in these kind of situation, that also shows the symptoms that the person is having spinal cord injury. And the last one is autonomic dysreflexia. That's a condition in which like the person feels a very high blood pressure. I will talk in detail about it in the coming slides. So wait for that one. Can we go to the next one, please? Okay, now this slide is very important. So please pay attention. In this, you can see like spinal injury uh, is divided into multiple levels. And as you can see, the color coded color coding of the body and the color coding of the levels, which can show you like it starts from the cervical level, which is C2. The first one is C2, okay? And then the second level is the thoracic nerves. Third level is the lumbar nerves, and the fourth one is the sacral nerves. So as you can see, the color coded. So if someone break the neck uh, around the area of the cervical, like C1 to C8, then depending on the level of the injury, they lose their sensation and movement. So if someone break their neck at the level of C1 and 2, then they don't have any sensation and movement in their head as well as neck. Similarly, like I am paralyzed at C4 and C6 level. So when someone break his neck at the C4 level, you can see that C4 means the patient lose the sensation and movement of all over the body below the C4 level. You can see the C4 level. So below C4, the person lose complete movement and sensation of the body. So neither his hand will work, the wrist extension, biceps, all those will go away. So he doesn't have any triceps or any hand movement. And all the things below that, like chest muscle, abdominal muscle, lumbar nerves, everything will go away. So wherever you get the injury, from that level, the communication, as I told you, the communication between the brain and the body gets disconnected, and because of that, anything below that, they are not able. We are not able to sense anything or move anything below that level. So I hope you are getting that, getting it clear that it depends on the level of injury, and depending on the level of injury, you can see in the patient what all movement they have and what all they can do. And depending on the level of injury, the the spinal cord injury is termed into two different categories. So first category we call is tetraplegia, or we can also call it quadriplegic. So if someone is quadriplegic, that means, or tetraplegic, that means he has got injury on the cervical level from C1 to C8, and that means he lose the ability of movement and sensation, everything below the neck. So no hand movement, no sensation, everything below the neck is not controllable by the patient. No movement is like control movement. If something happen, that might be the spasms or something. So involuntary movement might be there, but the voluntary movement, like the person is not able to control any part of his body below the cervical level. So quadriplegic is that no sensation and movement in any of his limbs, neither hand nor legs. He doesn't have sensation or control over the bowel and bladder also. And then the next category we call it paraplegic. So the paraplegic means the person's hand will be working, because you can see in the paraplegic, it starts from the thoracic nerve, which is T1. So from T1 and below, if you get any injury, then depending on the level, you will be able to move certain things, but not all the things. So below T1, if you get the injury, that means the person will have the movement in their hand, they have the movement, they have the tricep, they are able to hold things and everything. So above the T1 or T2, person is able to, can you click on that? So above the T1, person is able to do everything as a normal person, but below the level of thoracic, he won't be having any movement. I hope it is clear. So two major categories of the spinal cord injury are tetraplegia. We also call it quadriplegic. Quadra means like the both hand or both legs, nothing will be working. They both won't be, nothing will be having the movement and sensation. Paraplegia means the person will not be able to
I
move
had the
or
phone so far away, I don't understand.
pardon. Someone was saying something. Okay, let me continue. So the paraplegia means person will be having sensation and movement in the upper limbs, but not in the legs. Okay, so I hope the levels are clear to everyone, that depending on the level, wherever you get the injury, below the level of injury, you will have certain movement and sensation, and above the level of injury, you will be same like a normal person. Okay, can we go to the next? Now, coming to the next slide, uh, I can tell you that spinal cord injury are of two types, categorized into two types. One is complete injury and another one is the incomplete injury. So when we say complete injury means the cord the spinal cord is disconnected completely. It's like you can take it as if you know the wires which are coming from the brain to the body, they get disconnected completely. So if they get disconnected completely, then it is called as complete injury. So in complete injury, below the level of injury, there won't be any movement. It will be a complete loss of motor power, or you can say there won't be any movement below the injury. Okay, so this is the complete injury. Then the other type of injury is incomplete injury. So what happens in incomplete injury is the complete spinal cord won't get damaged. So some of the nerves in the spine gets damaged, whereas some are still safe. Okay. In that case, what happen is person will have some some the movement and sensation in any side of the body, but he won't be having complete injury. So he will be having some movement, like let's say if the person gets injury on the left side, the right side nerves are still working. So what happens in that case is some of the limbs or some of the sensation will be present in that person, and he will be categorized as incomplete spinal cord injury patient. Is it clear to everyone? Okay, can we go to the next page? Okay, now I want to show you, like, remember I was telling you about the spine and then spinal cord injury inside. This picture shows you how, in the second picture, you can see the outer shell is the bone. So this is the spine having the bone part, and inside, when you see the hollow pipe kind of thing, that is having the spinal cord inside. So the wires, you can call, they reside inside those hollow pipes. But what happens is, so in this slide, it's explained that how you can get injury, okay? You can get it in two different ways. In this one, what happens is that person is driving a car, and when he met the accident, his head goes forward very strongly and it hit the glass. Okay, in this situation, what happens is the head hit the glass very strongly, and because of that the bone gets broken, and if it is too hard, then the not only bone but the spinal cord also gets disconnected. I got my injury in this way. So while I was driving, uh, I hit something in the accident. My head banged into the glass or the steering, and because it was so hard that the strength, that the force of my neck gone till the spinal cord and the spine. So my spine got broken, and also the spinal cord inside the spine, that also got broken. And in my case, it was completely broken. So that's why I can say I have a complete spinal cord injury. Are you getting that one? So if it's completely broken, then it's a complete spinal cord injury, and you can get it in two ways. So first way is this one, in which the person is sitting straight, but the head bangs so strongly that the spine gets broken, and then the spinal cord also gets broken. Can we go to the next? In the second way, in the second category, as you can see, we got the vertical compression, in which, like, this is the case when you can see that the person dives into the water, and because the water is not deep, so what happens is the head hit the ground and the whole body weight is on that. Because of that, you can see the spine first gets crushed, okay, and then the spinal cord inside, that also get crushed, and the person can have either the complete spinal cord injury or incomplete spinal cord injury. So in this case also, you can see the spine bone is there, and the hollow section represent the spinal cord, which having the lots of nerves inside that, as I shown you in the first slide. Okay, so when this happen, the impact is very high because of the whole body weight on that, and because of the body weight and the force at which the person dives, he can get the incomplete or the complete injury. I hope this is clear to everyone. In case any doubt, please note it down. I will explain it in the Q&A session. Can you go there? Okay, now coming to this slide is very important for everyone, because in this one we are explaining, like, what are the main causes of spinal cord injury. If you know about the causes, you will you will be able to take precautions, not only for yourself but for the people around you also. So spinal cord injury, the main causes of spinal cord injury are divided into two different categories. One is traumatic and other one is non-traumatic. In the traumatic causes, it comes like road traffic accident. So you can see like the accident which can happen on the bike, which can happen on the car, van, lorry or something. And it can happen on the pedestrian also, like some of the old people, if they are not walking properly, they are coming down on the pedestrian and they slips down and break their neck. Okay. Similarly, cyclists also. So cyclists, they are going on the road and either someone hit them or they hit something and fall down and they get the spinal cord injury. The second category in the traumatic is the domestic and industrial accident. So this can happen if the people fall like from the stairs, from the ladders, or from the roof, accidentally. If they fall down, then that also can cause the spinal cord injury. Another one, another category, another reasons, or you can say cause can be the accident at work. So people might be working in a factory and then people might be working in a factory on the machines, they fall asleep or something, and suddenly, like, something hit them accidentally and they get spinal cord injury. So, as you can see, 2.8% people get the spinal cord injury at the work also. On the right side, you can see other than the road traffic accident and domestic and industrial accident, many of the people get in spinal cord injury during the sports time. So I have already shown you that the water sports injury or water injury, like someone diving in the shallow water in the swimming pool, that is one of the most, like causes of the people. So whenever someone, any one of you or your kids or any family member or friends and family, whenever you go at the swimming pool, please make sure that no one of them should dive in the shallow water, whether it's a swimming pool or you go outside traveling some other places. Until first thing you need to know is how deep is the water, then only try to dive. Don't dive without knowing the depth because you can end up in spinal cord injury. If it is not deep enough, you dive, your head will go down and hit the so that can cause injury. Another major thing, major cause of the spinal cord injury is horse riding. So while you are horse riding, if you fell down of the horse, down from the horse, that also can cause the spinal cord injury. Many people get spinal injury through that also. Next one is like people get sports injury during the skiing, gym or motocross, etc. So what happens is people don't wear the gadgets. Like let's say people are playing rugby. If they don't have the proper gadget or if they don't play injury, they won't put proper gadgets similar to skiing, gym, and all, there are other sports like cricket and other things. If you don't wear the proper gadget and you hit by the ball or you hit by the other person, then also you can get the spinal cord injury. So while playing sports also, you need to be very careful. Okay, not with your kids also. And the next one will be self-harm or criminal assault. So in that it is clear with the heading itself that some people try to commit suicide and like they jump from the roof or something, but in many cases they don't die. They just break their neck and they end up in the spinal cord injury. So please don't try to do anything similar to that. life is very precious, and the what you can say suicide or trying to harm yourself is not the way. Similarly, criminal assault, what happens is you fight with someone and they hit you on the back of your neck or back of your back by stabbing or by shooting at you, that also can cause the spinal cord injury. So try to stay away from the fighting. Like, you can have verbal fight, but try not get involved into the physical fight. Another section, like they call it the main causes for non-traumatic reasons. So traumatic reasons we have already discussed. The non-traumatic reasons are like because of some disease, like you get cancer or osteoporosis. Uh, Secondly, like, or you can get multiple sclerosis, or you can get inflammation in the spinal cord, or because of arthritis in the spinal cord. All these also can cause the spinal cord injury. So, the suggestion given is like for keep checking your health all the time. Okay, time to time you should have the complete checkup of your body so that you can know about anything similar to that happening, and you can take precautions or medicine so that you won't end up in the spinal cord injury. As you can see, although most of the ICI cases are due to traumatic causes, but nowadays even the non-traumatic causes like the disease and things which happen during the surgery, you can get the spinal cord injury through that also. So I hope the main causes of spinal cord injury is clear to everyone. And if you remember all these, please try not to do things which are mentioned in there, which can cause you the spinal cord injury. Can we go to the next slide, please? Now, coming to the this slide is also very important for the carers as well as patient and family member. So in this, we talk about what are the major risks involved in the spinal cord injury. So I have noted down as many things as I have experienced and I have learned over the years. So first one is autonomic dysreflexia. I will talk about this in more detail in the next slides. Okay, and I will discuss the others in this slide. So second major risk is UTI, that means the urinary tract infection. So what happens is if you don't take care of the catheter properly, and if the person is not drinking enough water and getting lot of sediments in their bladder, that can cause the UTI. So these risks can be avoided if the carers can keep the site clean and keep motivating the person to drink as much fluids as possible, because the more fluids you take, the less are the chances of UTI. Next risk is hypertension and hypotension. Hypertension is another major risk. That means like it can happen. It's part of autonomic dysplexia, in which your blood pressure rise very high and very quickly. So you should know about this risk, and you should also know about how to resolve it. Okay. So in case of hypertension, there are medicines which you should keep with the patient all the time, so that in case if he feel if he gets the hypertension, immediately that you even if you are aware of the medication, you need to give that medication to control his high blood pressure. Similar to hypertension, the HCI patient also gets risk of hypotension. Hypotension means it is different from hypertension. So you need to remember hypotension is when the patient's blood pressure goes down. So in SCI, spinal cord injury, you can get both hypertension as well as hypotension. And the causes for both of these two things can be different, and you should be aware of the causes. We will discuss about it in more detail in the coming slide. So hypotension means when the blood pressure goes very down, and it happens mainly in the during the phase when you sit up the person either in the bed or in the chair. So what happens most of the time, if the person is lying in the bed, when you sit him up, the blood goes very quickly from the head to the toes, and because of which the brain feels like less blood in there, and the blood pressure goes down, because of which the person feels dizzy. They can feel blurred vision also, and they can pass out. So all these things are life-threatening. I am explaining about it as much as possible. So this slide is very much useful for the patient should be knowing about it. The carer should be knowing about all these things. And that's why I'm trying to explain and putting more emphasis on each of them. The next one is muscle spasms. So in some of the spinal cord people, you find that they get lot of spasm, lot in the sense that their body keeps shaking so much that there are chances that they can even fall out of the bed. So in such cases, you have to be careful, and these can be controlled through the medicines given by the doctor, and in some cases we put the splints also on the areas where it's where you get the spasms, like higher spasms in the leg. We put the T roll or the splints which can capture the legs straight and won't allow them to disturb your body and save you from falling out of the bed. Another major risk involved in the spinal cord patient is the pressure ulcer. These are the most uh, important to know because these can be caused if the person is lying on something, or the person's skin is not well. So what happens is, in many cases, the carer or family member should be very careful that whenever you are caring for a person, every time you roll them, you need to check uh, the dots, like the red mark on the skin, which can happen because of you the patient lying either on the wrinkles for long time, or sometimes, let's say, if the carer can forget their pen, their keys, or anything which on which the person will be lying, and the body will not be uh, able to communicate, because in the normal person, if he is sitting on some keys or something, he will feel it and you can remove it. But in case of spinal patient, if he is lying on something, he won't be able to tell that he is lying on that. But if he's lying on something hard or some wrinkles, he can get pressure sore, and the pressure sore are the major reason of the spinal cord injury patient's death. There is a saying about pressure ulcer that it takes hardly 20 minutes to get a pressure sore, but for healing the pressure sore, no one can predict, because it can take 20 hours, 20 weeks, or even 20 years, or it can even end up in the life. Even the patient can die because of pressure ulcer. So you can read about pressure ulcer more in detail uh, on the website also. but this is very important to know about, and that's the reason as a carer, whenever you reposition, you need to reposition patient every 3 hours or so, and whenever you are repositioning, you need to check the skin thoroughly for any red mark. So if there is any red mark, you need to keep the patient away from that red mark. I mean, like, let's say if there is a red mark on the left side of the bottom, then try to not go on the left side for some time so that there won't be any pressure on the red mark and it will not turn out as a pressure ulcer. So that's the task of the carer, to keep an eye so that the patient won't get pressure ulcer. The chronic pain is another major risk, which so the chronic pain is another one which can uh, be a major risk and very disturbing to the patient. Most of the spinal injury patient, they get lot of pain in their shoulder, neck, and biceps. This is common among the spinal cord injury. So they need to be provided proper painkillers or gel like ibuprofen to reduce the pain so that patient won't be irritated or can live his life with less pain. The next risk is the blood clots. So if there are spinal patients who cannot move, like some of the patients with the higher level injury, if they are not able to move, they are staying in the bed most of the time, then that can cause the blood clot. And for saving the patient from the blood clots, the nurses or the GP or the doctor should provide the blood thinners to the patient, otherwise, to make the blood thin so that it can flow easily. Otherwise, the blood clot can happen anywhere, and that can result into the stroke. If it is in the brain, it can result into stroke, coma, or uh, completely pass out of the patient. Next one is sepsis. Sepsis is like the infection the about which the cause is not easy to find out. So what happens is people get infection and it spreads all over the body, uh, and it's not easy. Like infection is one place uh, where the doctors are able to find, like, okay, infection is can be at the catheter site, so that is easily curable and taken care. But if there is infection the cause of which is not discoverable, then it becomes very difficult for the doctors and patient, and the patient can die also in those situations. Second, the another one is the respiratory complication. This happens for the people with the higher injury. So if someone is having the injury at C1 or C2 level, they are not able to breathe properly and they need ventilators for that. So people should be aware of how to use ventilator and how to monitor the patient regularly to make sure that they are able to breathe properly, either with the oxygen or by putting them on the ventilator and other things. Next, and other behavior related risk involved, that the SCI patient uh, becomes very disturbed. So the person mental, emotional, and social well-being get disturbed because previously he used to do everything on his own and it was so easy. But now, after the spinal cord injury, the person becomes dependent on others, and sometimes, the patient is not when patient is not able to do things on his own and he wanted to do things in his way on his desired time, and if he is not getting those kind of things, the patient become very angry. So you can see the anxiety, stress, anger, and they feel like staying alone, not sharing anything with the other person. You can see them in very low esteem, and all those things are normal in the spinal cord person, and all these things can happen because he is not able to do things, and others he depend on others, and if he is not getting things done in his way, then all this can happen, and these also can end up in the depression and other things, because of which the person can die early, you know. Can we go to the next slide? So I hope uh, you have done the proper attention in about the what are the major risks of the spinal cord injury, because only if you know the risk, you will be able to handle it for the patient, and you will be able to make them like more involved, more motivated. Now coming to the autonomic dysreflexia, this is one of the major cause. Like you can you can call it uh, so to define the autonomic dysreflexia, you, what happens is, because the rest of the body gets disconnected from the brain, so if there is any discomfort at the level below, in the body which is below the spinal cord injury, then what happens is body try to communicate to the brain that something is not right, something is hurting, or something is painful. But because that signal doesn't go to the brain, so what happens is body has another mechanism of trying to trying to pass this message that something is not right. So in that case, what happens is uh, the blood pressure of the person start rising up, and we call it as a autonomic dysreflexia, because it consists of many common causes, and in this what happens is, because the body is not able to communicate with the brain, in situation like that, for the normal person, as I told, if someone is feeling discomfort, they can immediately remove that discomfort. But in spinal cord injury, because the cord is disconnected, so what happens, body try to communicate to the brain, and the signal cannot reach in the brain. So what happens, the person start feeling different things. His blood pressure will be high. That's the one thing which can tell you that something is not right with the patient. So if person is saying that I am feeling headache or restless, something is not right, or you can start sweating and all, then when you check the blood pressure, if the blood pressure is high, that means he is going through the phase of autonomic dysreflexia. So immediately what you need to do is, you need to find the cause of it, because the blood pressure goes so high in very less time that the person can die if you don't find the cause of it. Okay, so the to help you out, the main causes of autonomic dysreflexia, or you can say the rising of the blood pressure, can be if your bladder is distended, which, which means that your urine stops draining, let's say because of your catheter is twisted or it is blocked. So if your bladder is distended, then the body tries to tell you that bladder is full, you need to urinate, and because the communication is not happening, your blood pressure will rise very quickly. So two main causes of the autonomic dysreflexia in the spinal cord patient is the distended bladder and if the person is constipated. Okay. Other main causes are if the person is having pain, which can be caused by the pressure ulcer or by the fractured bone or by the skin burn or because of the UTI and or maybe anything like ingrowing nails or can be any condition because of which the body is facing the discomfort and it tries to communicate to the brain that something is not wrong not right. So in that case, the blood pressure rise very quickly. Okay. You can also say that the other name of autonomic dysreflexia you can remember is the high blood pressure. Whenever you face autonomic dysreflexia, your blood pressure will rise very quickly. Okay. So if you find someone having very high blood pressure, then you need to find the cause very quickly and you need to try to resolve the cause so that the person can be saved from the high blood pressure. This can be done by giving some medication also, but try to first try should be to remove the cause because once you remove the cause, the blood pressure will come down very quickly. And if it is still not coming down, you need the immediate medication. Like there are medication like GTN spray, which is provided by the doctors. So you need to put the one spray of that in the mouth to reduce the blood pressure. Can we go to the next one, please? Okay, now this screen is also very important because in this I have tried to describe what are the causes of the autonomic dysreflexia. So one thing which I want to explain is this that autonomic dysreflexia usually happen it doesn't happen in all kind of spinal patient. It usually happen in the patient who has got higher injury. Higher means anyone having the injury above the thoracic level, above the T level. Okay, if anyone has the injury above the T level, then they have more chances of getting the autonomic dysreflexia. So, how you will identify? So you can find the you can identify if the blood pressure goes high, like 120 or 80 is let's say normal blood pressure, then suddenly the blood pressure goes to 160, 190 or even 200 very quickly. So if you find that kind of blood pressure, then you can quickly understand that he is going through autonomic dysreflexia. Similarly, you can see slow rate of heart. Similarly, slow or fast rate of the heart. If you see that, then again, it tells you that something is not right. I already explained that the person going through the high blood pressure or autonomic dysreflexia, they experience severe headache because of the high blood pressure. They can have blurred vision. They can have nasal congestion. They can start sweating. Their body can start sweating. So in uh, different persons, you can find difference in symptoms. Some people start sweating. Some people start getting headache. Some people will start showing the goosebumps, or they can start showing the fever or something like that. Okay, but uh, it cannot be same in every person. So like in my case, if I get some problem in the body, I get severe headache, and that indicates me that something is not right. So I call the nurse and say like, can you please quickly check? I am getting very severe headache. So in this case, what you can do? So if you are facing if you find any of these kind of symptoms and the patient is complaining any of these kind of symptoms, then what you need to do? So this is very important to know because like this you will face many a time, and you need to act very quickly, because the blood pressure, if the blood pressure is very high, person can go into stroke, they can have heart attack, or they can even pass out. So it is really life-threatening situation. So what you need to do when you find the patient is having high blood pressure or he is going to autonomic dysreflexia, both are same. So what you need to do is you need to first sit up the person as high as possible. When you sit it up, the blood pressure will go down a bit. You need to check whether he is having any tight clothes which can be causing any problem on his body. You need to check his blood pressure to see whether he is having the blood pressure very high, and keep monitoring the blood pressure like frequently, while trying to find the solution, the cause of it. You need to check the bladder. I have already told that in most of the cases, the bladder and bowel are the major cause of autonomic dysreflexia. So in case of bladder, if the urine is not coming out of the catheter, the reason can be like the catheter is blocked. Catheter is a tube which goes inside your bladder, which is put inside your bladder to take out the urine uh, after you become the spinal cord injury, because the SCI patient don't have any sensation, so the doctor put a catheter which goes directly into the bladder so that the urine keeps coming out. But in case the catheter is blocked and the urine is not coming out, then it can cause autonomic dysreflexia. And the cause of blockage of catheter can be some sediments which is coming out in the urine, or because of reasons like the catheter gets twisted or catheter get kinked. Okay, so you need to check the bladder and the catheter. That should be the first step from your side, because this is the major cause. Second cause can be that the person is constipated and his bowel is full, but he is not able to open bowel himself. So if you don't do the bowel care for long time, or if you are not getting proper results in the bowel care, then that can also cause the autonomic dysreflexia. The next one is it can be because of the skin problem. As I told you, like it can be because of the wrinkles on the sheet, or it can be because of something on which the person is lying on. It can be because of some insect biting it, or some cut, or any kind of pressure sore. So you need to observe the skin very quickly if you find. So first attempt will be you need to sit the patient up if it is autonomic dysreflexia. You need to remember that these things you need to do when you get the hypertension or autonomic dysreflexia. There is another one which I told you, the risk is hypotension. Don't do these things in the hypotension, because it might kill you. So in the hypotension, what happens is your blood pressure goes down. That mainly happens when you sit up the patient either in the bed or in the chair. So what happens when you, because of because most of the time patient is lying in the bed, so when you sit him up, the blood from the head side goes very quickly to down to the leg side, and because of that there is a scarcity of the blood in the brain, and that causes hypotension. So please understand the difference between the hypotension and hypertension. So hypotension is treated in a different way. In case of hypotension, you don't need to sit him up. You need to lie him down and you need to raise his legs up. Okay. And in case of hypertension, that is the higher blood pressure, which we call autonomic dysreflexia, you need to do the opposite. That means you need to sit him up, check the clothes, check the blood pressure, check the bladder and bowel. Also, you need to check the skin. So, in summary, you need to find the source of the problem as soon as possible, and you need to resolve that problem so that the blood pressure can come back to normal. Okay, so these things you need to keep it in mind while you are taking care of the spinal patient. Okay, and even then, if you are not able to find the cause or symptom of it, you need to call the ambulance very quickly, because otherwise he can die, because of the high blood pressure. Obviously, you need to give the medicine to bring the blood pressure down. But yeah, if you are not able to find the cause, you need to send him to the hospital or call the paramedics. I hope these things are clear about the autonomic dysreflexia. So I have told you about the causes, and I have told you about the solution, that like what you need to do in case you find the person is having going through autonomic dysreflexia or high blood pressure. Can we go to the next slide, please? Now,
Oh, Alok,
yeah, sure.
may I ask you some question, please?
Can you note it down, Sean, and I will answer you at the end.
Okay.
Okay, please. Okay, now coming to this slide. This slide is also very important because uh, if we know the causes of spinal cord injury, then we should know how to prevent from getting the spinal cord injury. Okay, so this slide tells you about how to prevent yourself from getting into the spinal cord injury. So first one is the, as we know, like most of the spinal cord injury happens the due to the thing which are unpredictable. Okay, which are simple, but it can happen if you are not aware of it. For example, uh, and yeah, if you get the spinal cord injury, then what you need to prevent is you need to stabilize the neck, and you need to stabilize the body, and you need to take it to the hospital as soon as possible. If you guys are, if the people are not aware of stabilizing the body, which happened in my case, then what happens is, as you can see that in case of spinal cord injury, many times what happens is only your bone gets broken, but your spinal cord is still intact there. So there are chances of recovery. But what happens is, if you don't stabilize the patient neck and body, then what happens is, while traveling, his neck keeps going here and there, and because the bone is broken, the broken bone acts like a knife. Okay, so the person's spinal cord might not have broken during the accident, but if you don't stabilize the neck, then that broken bone will keep cutting the spinal cord, and then from just the compression of spinal cord injury, you can become a complete injury. So if you stabilize the neck of the person and the body, there in many cases there are chances that you can recover from the spinal cord injury, because the tendons, like the nerves, are still alive there, and they just got compression. They won't get disconnected. Now the second way of preventing is always wear the seat belt while driving the car. This is like, although this rule is told, and in our Western countries, there is a big fine for that. Although there are fines in other countries also, but people usually don't wear that, and that increases the causes of spinal cord injury exponentially. So always keep your seat belt on while driving the car, because as you can see in that picture, if the seat belt is not there, your head is going to bang on the steering or in the glass of the mirror of the car, and that will cause the spinal cord injury. If you are strapped with the seat belt, then chances of you being saved from the spinal cord injury is very high. Similarly, while you are playing any sports, you need to wear proper protective gears to save you from the spinal cord injury. Like, let's say you are playing cricket, don't forget, many people wanted to show there and they don't put the helmet, but then that is dangerous. Similarly, you can see like wearing the helmet and other gadgets are very important. So whether you are playing in the professional game or just at home, please don't forget to wear the protective gears while playing any risky sports. Similarly, never dive into the waters, into the shallow water. So before diving, you need to find out how deep it is. Okay. And try to not dive, like, unless you are a professional swimmer or you have learned how to dive properly, don't dive. Just go into the water not normally and enjoy it. Okay. Even if you know diving professionally, my suggestion would be first go into the unknown water and check the depth of it, because it can you can end up in the spinal cord injury, as I told you in the causes. Then another thing is, never drive if you feel unconscious. Like, if you have drunk or driving, please try not to do that, because that can also end you up in this horrible life. And most important thing is, never allow the person who is sitting on your side to sleep. Okay, because sleep is very contagious. If anyone is feeling sleepy, you can ask them to go on the back seat and sleep, but please try not to allow the person sitting on your right, on your side, to sleep, because it has been seen that if the person sitting on your side is sleeping, there are very good chances that you also get sleep while driving, and you can hit something and get the spinal cord yourself. And in case you hit some other car or another person, then they also can get spinal cord injury. So please don't allow the person sitting on your side to sleep. Okay. Similarly, be careful even if you are walking on the stairs. This is especially for the elderly people or even young people. Like, sometimes they are in hurry, they jump multiple steps to come down, and if they land up in a on the stair corner, then they also can get the spinal cord injury. So please be cautious. And last thing, which I have told while discussing about the non-traumatic injury also, that please keep doing regular checkup of your body, so that if you have some trauma in your spine or some issue is going on, then that can be treated at the early stage instead of uh, treated at the later stage, in which, like, tumor becomes big and you require the surgery, and which can cause you to end up in the spinal cord injury. So all these, uh, if you know all these, then you can prevent yourself and your surrounding people from getting into the spinal cord injury. Can we go to the next slide? Okay, guys, we can take a 5 minutes break here so that I can go to the next section of the training. And can we resume after 5 minutes? What's the time now? Pardon? It's half 11. So yeah, we can take a break of like 5 or 10 minutes. We have time. So please take a break. Feel comfortable. And can you, Lee, can you pause my recording, please? Go there, click on more, click pause. Okay. Guys, I hope everyone is back
Yeah.
because we are behind in time. So let me start again. So now I have already explained you about what is spinal cord injury, what are different levels, what are the causes, how we can prevent it, what all risks are there. So now we will be talking about, even after all the precautions, if the sorry, if the person gets spinal cord injury, then what all things are required to take care of them and to enable them to do the things which uh, he wanted to do after the spinal cord injury. Okay, so in this slide I have captured like what all things are required after someone gets into the spinal cord injury. So first and foremost, they will they will be requiring the nursing and the carers who will be taking care of them. And there are multiple things here which I have mentioned. These can be present in one person, two-person, or even five-person. Okay, and nursing and care that can be provided by professional nurse and carers, or if the person is in home, then sometimes it can be provided by the family members also. So they need the nursing and carer. They need the assistive device such as splints and wheelchairs so that they can use them and go out and do things which is otherwise not possible uh, to do for the because of the no movement and no sensation in the body. They will surely require the physiotherapy, means like in physiotherapy they will give you exercises to keep your joints flexible, because if you don't use the limbs and keep them just like that, they will join the joints of the limbs will become stiff, and just in case if any cure is available, you won't be able to use your hands and leg, even though the cure can fix your spinal cord injury. So you will need the physiotherapy and occupational therapist. So the occupational therapist, what their job is to provide you, to make you enable so that you can work. They can help you in accommodation. They can help you in finding the splints which can help you in doing things like writing, or using the voice software like I use to control your laptop and other things. So the people will be needing the physiotherapy, occupational therapy, respiratory specialist in case that the injury is very high. So in those cases, people will be on ventilator. So respiratory specialist is also required. The next one is pressure clinic and wheelchair services. So I already explained you about the pressure sore. So people will be required to check the pressure of you while sitting on the wheelchair, so that they can provide you cushions on which you can sit for longer time. Because if you sit just like that for longer time, then the chances of you getting the pressure sore will be very high. So to avoid the pressure sore, they will provide you with the proper cushion in your wheelchair. Similarly, you need the clinical psychologist, so that when the patient is in bad mood or in depression and not feeling good, the psychologist can come and help them in getting better. They will need the dietitian, so that dietitian can tell what all things they need to eat to get the muscles back and to maintain their muscles in the body. Tissue viability nurse is also required in cases where you get some kind of wound like pressure ulcer or any kind of wound. In that case, if the wound is not healing or the pressure sore is not healing, you will require the tissue viability nurse to help you in treating that big wound through surgery or through the medication and proper care. You will need the contingent management also, because the spinal cord people will require getting the bowel care and bladder things done by the nurses, and uh, the carers will be required to monitor them so that they won't be lying in the poo or in the urine for a long time, because those consist of the various chemicals which can harm your skin and you can get pressure sore very easily. You, the people with the higher level of injury, they require the speech and language therapy also, because of the higher injury like cervical 1 or 2 or 3. They won't be able to speak, they won't be able to move their head. So what the speech and language therapy do is they told them various other ways of communication, like by using their eye movement or by using the lasers on their head and things like that. Similarly, you need someone to adjust your sitting and posture, to make sure that you are sitting in a proper posture in the chair, or you are sitting or lying in the bed in a proper posture. Because if you don't sit in the chair properly, then chances of many problems will be had, like your pelvis can be twisted or you can get pressure sore, and even the wheelchair and other things, if they are not proper, then it can make you uncomfortable. So you will need someone to see your sitting and posture and accordingly adjust your wheelchair to make it suitable for the person as per their weight and as per their physical physical features and all. The other thing which the spinal cord patient required is, once they are out of the hospital, like in the hospital, they mostly, in most of the cases, they do surgery of the spinal cord, in which what they do is they provide a cage. So like in my case, my C5 was broken. So what they do is they put a titanium cage on which starts from the one level above. So if my C5 is broken, the cage starts from C4 and then it ends up in the C5 or C6. So they do that to stabilize the neck. If they don't put the cage, it will be very difficult to hold your neck properly after the spinal cord injury. So in that in all of these will be required by the spinal cord person after they get into the spinal cord injury, and with the help of all these professional uh, professional people, or the you can say professional knowledge, it becomes easier to for the spinal cord injury person as well as carers and the family members to take care of the spinal cord injury people and make them live life for a similar to a normal person, which is not possible without all these professional services. Can we go to the next page? Okay, so now coming to this slide is also very important. So please concentrate on whatever I am saying. So there are some things which we need to do for the spinal cord injury on the daily basis, and in that, like, these daily, or you can say regular basis, which can be daily, every day, or it can be alternate days, but these things are done very regularly. So everyone should be aware of these things, especially the carers should be aware of how to deal with all these things. And patients should also be, if someone is having spinal cord injury, they should also be aware of all those things, because if the patient is aware of how to deal with these things, then they can tell the carers, and they can train the carers also if they are lacking on something. So first thing is the bladder management. As I have told in the during the risk time, that bladder management is very, very important, because if the bladder is not managed properly, it can give you autonomic dysreflexia and can cause a lot of problems. So autonomic dysreflexia I have already explained. So what happens if the person is not able to urinate because of the problems with the catheter, like if the catheter is twisted or kinked, or if it is blocked, then it can cause the autonomic dysreflexia. So what happens is, after the spinal cord injury, when people are not able to control their bladder, what the doctors do is they provide them the catheter. The catheter is kind of a tube which goes into your bladder and helps you to urinate when it is full, or even like if it is directly connected. It depends on the type of catheter. So the catheters are of multiple kind. Like, it can be an indwelling catheter, which goes from your uh, what you call, from your private parts, and stay into your bladder. So what they do is they put a tube through your penis or vagina, and the tube will go directly into the bladder, and whenever there is a urine, it comes out through that catheter. Okay, so indwelling catheter is there, which goes through your private part. Second type of catheter is suprapubic catheter. This is the catheter which goes through your tummy directly into the bladder. So what happens is they do a pinhole surgery and then put this type of catheter directly into your bladder, so that whenever there is a urine in there, it will keep coming out. Next kind of catheter is self-intermittent catheter. These are used by the people who have movement in their hands. So what they do is they put the catheter inside through their private parts, and then urinate whenever they are required, and then they take it out again. So in this case, the catheter don't stay permanently into the person's bladder. It will be inserted whenever the person wants to urinate, and then they can take it out. This is considered as little safer, and less infection is there, because uh, it helps, like, anything you put in the body of a spinal cord patient, anything external, uh, then the chances of the infection and other problems are always higher. So in the self-intermittent case, they put the catheter whenever it is required, and then they take it out. So the catheter won't stay inside. And because of that, the chances of urinary tract infection is low. The other kind of catheter is the condom catheter, which goes on the penis, and and helps in the person to urinate. Urodynamics, you should also be aware of urodynamics. What they do in that is they keep a check on the capacity of the bladder. And what happens in the spinal cord injury is if you put the catheter directly into the bladder, then what happens is whenever the urine comes, it comes straight out. So the problem happens is that the capacity of the bladder start decreasing because we are not allowing the bladder to inflate and deflate, which happens in the normal person. And because of which the capacity of the bladder starts reducing, the bladder starts becoming smaller. So to avoid those kind of things, we use the flip flow. A flip flow is like they put a tap near the catheter, which they close for some time so that urine gets accumulated in the bladder and it will keep maintaining the capacity of the bladder so that your bladder will stay healthy. Okay, so we keep the flip flow, the tap closed for certain hours so that the bladder will fill up, and then we open it after some time so that whatever urine is there, it can flow out of that. Similarly, on the regular basis, we need to do the bowel management also. So the bowel management in the spinal cord injury is done through digital stimulation. It is different from what they do into the normal patient, because for the normal patient who is not suffering with a spinal cord injury, you can do the manual evacuation, like you put your finger inside and then do the manual evacuation. But in case of spinal cord injury, you need to do it digital stimulation, which is a completely different process in which like the person put the finger inside and do the stimulation very gently to make the to like trigger the reflex of the blood of the rectum, which helps in pulling down the stool into the rectum and which can then be taken out. So all these things you will learn in more details when you go on the internet and find out. It's very difficult to explain everything in detail because each of these things require a separate session to explain everything. But I have taken it so that I can explain in a as little manner as possible. So in bowel management, you can you need to do the digital stimulation, and there are other devices which are used like Pristine and other kind of equipment for emptying your bowels regularly. Because if it's not emptied regularly, then it can cause again the autonomic dysreflexia. It depends from person to person. Some people require it daily, some people do it on alternate days, and some people can do it twice a week. Depends from patient to patient how like what suits to them. Okay. The next one is the skin management. This is also very important because this also can cause autonomic dysreflexia. So to save people from getting pressure ulcer or pressure sore we call it, we have to monitor, we have to take care of the skin, and that's what comes under the skin management. So whosoever is taking care of the patient, they need to make sure that the person is not wearing tight clothes, not wearing the tight footwears, and they need to do regular repositioning. Repositioning means changing the side of the patient from left to back, back to right, so that the patient won't stay in same position for a long time. Because if he stays for a long time in one position, then the skin can be damaged and they can get pressure ulcer. So all these knowledge should be there uh, with the carer so that they can avoid having the skin problems. Okay, so regular repositioning is required. We need to be careful with the hot and cold things because the person won't be able to uh, feel it. And if you put something very hot or very cold on his skin, that can cause the burn and that can later cause the autonomic dysreflexia. Similarly, wet clothes, or like wet clothes, I mean, is person can bypass and the patient can lie, should not lie in the urine or in the stool for longer time because if they lie in there, the stool and the urine, they have the chemicals which can damage your skin. So all these things need to be taken care by the carer so that the person won't get any problem from the skin. Okay, they need to be repositioned. They need to be checked for everything. Like whenever you are repositioning, there should not be anything left under the patient. Similarly, when they are going into the wheelchair, you need to make sure that they are not sitting on the wrinkles or they are not sitting on something left behind. All these things are the responsibility of the carer or the family members, because if they don't check all these things, then there are very good chances that the person can damage his skin, and once the skin is damaged, it takes long time to heal, and no one can predict how long it can be. They say that it can take only 20 minutes to get the skin problem, but it can take 20 weeks or 20 months or even 20 years or to heal them, and there are chances that person can even die because of this small ignorance from the carer side. The next one is therapy services. So the occupational therapists and physiotherapists are required to to tell about what all splints can be used so that to make person enable, like they can write or they can do different things. These comes under the occupational therapy, and the physiotherapist should tell and teach the carers about what all stretching and what all exercises need to be done to avoid the stiffness of the joints in various limbs. Okay, so regular exercises need to be done. So that also is part of regular uh, services required for the spinal cord injury. Similarly, sexual functions needs to be explained to the spinal cord injury and need to be explained to them that even after the person gets spinal cord injury, there are ways through which they can have sex and they can produce kids, uh, same like a normal person. The There are some medicines and things provided by the doctor which can help you in having the normal sex with your partner. So these things also can require the carers just in case, like if the person wants to have sex with their partner. So the carer should be aware of these things also, how to provide help to the spinal cord person in case they wanted to have a child or anything. The other things which comes into the picture are like just in case if person goes to the home, then the carers, physiotherapists, and other need to provide various things like adapted accommodation will be required. So whichever home he is going, his home needs to be adapted. They can help the patient to get back to their employment. The psychologist can help the patient in uh, getting out of the low mood and depression. Other than these, the carer should be aware of all the things like personal care, including the shower, including a know-how about the operation of manual and electric wheelchair. Because if they don't know, then they won't be able to help the patient when the things are required. So all these things needs to be done on the daily basis. So carers should be aware of all these things, and unless they are aware, they won't be able to help the SCI patient, and which can be problematic. Okay, so please, because of lack of time, I am not able to explain these things in more deeper detail, but I can expect you guys to read about them, more about them through the internet, as I have touched base on them, uh, with the hope that I am able to explain the basic need of them, why they are needed. Okay, can we go to the next slide, please? Okay, apart from that, this slide, in this slide, I have tried to explain that not only the doctors or carers, the patient himself should also try to learn things and to be active and to try to get improvement. And in this slide, I'm trying to say that even after getting the spinal cord injury, if the patient can try, they can convert their disability into capability. And trust me, all the things which a normal person can do, most of those things can be done by the spinal cord injury also, because there are a lot of things uh, available in the market which can help you in doing all the things which are otherwise not possible about after the spinal cord injury. So the support of friends and family and a never giving up attitude of the person can make them use of lot of things which are available for doing all the things which a normal person also can do. For example, with the help of physiotherapists, they can have stretches and they can do things which can keep them ready and fit for the circumstances in which some uh, some cure will be available. Okay, there. Okay, some people, like, if they are if they are getting the spinal cord injury at the lower level, so in normal circumstances they cannot walk, but the wheelchair is there to help them out to walk. So even after having the spinal cord injury, they should not feel like they cannot do things. There are so many things which can help them in doing all the things which they want. It's just that they need to be motivated and they need to provide little extra effort. So rehabilitation is there, in which, like, physiotherapists and occupational therapists help them in getting settled and getting splints and other equipments which can help them. Similarly, the OT help the spinal cord injury patients in adapting their home in such a way that they can go and they can do lot of things on their own by with the help of splints and other things. So I have put the websites here which can help you, like Disability Aid. There is a website when you go in that website, it will provide you a lot of information about how you can do things. Similar to that, there are websites on which you can find lot of different kind of splints which can help the spinal cord people to do things which otherwise they can't do. So splints can help you, like for example, if someone wants to write something, okay, they don't have much sensation, but like at some levels you can write irrespective of your hand is not allowing you. With the help of physiotherapist, you can strengthen your arm, and then with the help of a writing splint, you can learn how to write or you can learn how to sign things. I will show you these websites at the end when I will, because I don't want to leave this presentation as of now. So I will show you these websites and I will show you what all things are available which are helpful in enabling the spinal cord injury people for doing a lot of things which they cannot do outside. Next one is the assistive technology. I will talk about it in the other slide, in which you will see that there are so many technologies available nowadays which can make you enable. Like for example, I am able to connect and control my laptop with one of the assistive technology which we call the voice recognition system. So I'm using the voice recognition system irrespective of getting paralyzed neck down. I'm able to control my laptop. I can talk to the people. I can browse the internet and do lot of things. So which a normal person can do. In fact, like with your efforts, you can do more than the things which even the normal person can do. So I will talk about it in next slides. Can you go to the next slide? Okay, so this slides I've tried to capture about the various things which the carers or the family members can do. Can you give me some water, please? So, which the carers and sorry, which the carers and family members do to help the spinal cord injury people in getting in doing various things. So first thing, as you can read, as a carer, you need to keep encouraging the patient and keep motivating them by keeping them more active and keeping them more moving. Like you need to encourage them to sit up, to go out, to do things, to participate in various activities. Because sometimes if people is feeling lonely or depression, they will try to stay in bed and keep sleeping. But it's the duty of the carers or family members to encourage them to keep and to stay active and to keep moving and doing as many things as they can. They can also, it's the duty of the care and family to help them by providing access to as many instruments and machines as possible so that they can stay healthy. So instrument and machine, the examples can be, they can be provided a cycle, a motomed we call it, in which they can do exercises of their hand and legs to keep them more healthy and to keep them more healthy and to keep them sorry, I'm getting little bit down, so sorry for that. To keep them more healthy and to help them in strengthening their hand and legs. Okay, So you can provide them cycles, you can provide them splints and other things. Also, the carers and the doctors and the family members need to set some long-term and short-term goals, like doing some courses or help them in motivating to do something in the area of their own interest. Like, for example, they can motivate the person for doing any course, various courses, and help them in doing lot of things which can help them in becoming becoming more effective and becoming more capable of doing lot of things. Also, you can help them in your best way to make them accomplish their goals. So, like, say someone set up a goal that I want to do a course, I want to do a degree, then it's the duty of the carers to help them in setting up the goals and set up like certain hours in which they can help them to learn or do things practically. Similar to that, you need to include them in as many activities as possible, and you need to include them in various processes going around them, so that they won't feel that they are not allowed in participating various things just because they are disabled. So they should not feel like that. So motivate them and like inspire them to do as many things as possible and participate in as many things as possible. With your help, they can do all these things. So that's why I put the heading that what other people like, not only patient himself, but how other people can help them in becoming better every day. Okay. So talk about something they like. You can spend some time with them and take them out to different places. These are also various ways in which you can help the patient in not getting into the depression and uh, getting the inspiration and believing that even after a spinal cord injury, they can do lot of things, okay, and they can become enable, like instead of disabled, they can prove that they also can do lot of things, okay, similar to the animal people. I hope you got all these points, and with knowing all these points, you will be able to help as many paralyzed or disabled people as possible by motivating them, by inspiring them, and by taking them to participate in various things, so that they won't feel alone, they won't feel left out, and they can keep getting inspiration that yes, spinal injury is not the end of life. They can do lot of things. Okay, can we go to the next slide, please? Just go to the next slide. Okay, I told you like I will talk about the assistive technology. So there are a lot of assistive technologies now to help the people with spinal cord injury or any kind of paralysis. Okay, let me quickly. Sorry guys, can I have a sip of water? I'm feeling a little funny. Thank you. Okay, so there, even after spinal cord injury, nowadays there are a lot of assistive technologies available which can help the spinal cord patient to turn their disability into a differently able person. Like, for example, there are lots of disability apps there which you can use in your phone, and you can operate your phone or the laptop using various available software. Like, there is a software called Dragon Naturally Speaking, which I have been using, and without that, I won't have been able to do much because uh, even after spinal cord injury, I learned that software, that application, which is called Dragon Naturally Speaking. So with the help of that software, I'm able to control my laptop. I'm able to browse. I can do all the things which a normal person can do on their laptop. So disability applications are there. There are a lot of driving controls which are available to enable the disabled people for driving the things. So people who are paralyzed and who have got even a little strength in their hands, they can drive their own vehicle and they can get vehicle from the people who are supporting this kind of injury. You can get lot of electronics and software which can help you in controlling your lights, your fan, and all your electrical devices. So all these can make you independent. So you previously you used to be dependent on your carer or family member for everything, but now a lot of technological things are available which can enable to which can make you independent and you can do everything on your own. Like for example, Alexa is there. Even your iPhone is there in which you can uh, set up like Alexa, or you can set up various electrical things. You can configure them so it can be controlled with your voice. Like I control my lights, my fan, my many other application electrical things with just voice. So what I do, I have configured the Alexa and I Siri also. So even while I am around in my home, I can control them from anywhere. So what I do, I have installed the applications and I just say like Alexa, turn off my light. Alexa, do this. Alexa, do that. And just with the one line command, it just do it for you. It has become so simple nowadays. So nowadays, in summary, the spinal cord injury, whatever level is there, if they are able to speak or if they have eye movement, they can control everything in their room and even outside their room. Uh, like curtains they can close on their own. They can do a lot of things, calling the bell. You don't need the person to call the bell. You can just say, Alexa, call my bell, or call the carer for me or family member. This not only enables the patient, but these are also helpful to the family members and carers, because of these, the spinal person is capable to do a lot of things on their own, and he doesn't need to disturb the carers or the family members for everything. You know, these things provide lots and lot of help and give the independence to the care to the patient so that he can do a lot of his work on their own. Like you can see, there are hearing devices on which you can put audible books and all. There are a lot of home products. There are lifts and which can take you up. There are a lot of mobility aid devices. Prosthetic things are there which people can wear and they are able to run and do things. Robotic things are coming very soon, which can help you in replacing the carers. Very soon you will see the robots which will be working with you, and you can command them for getting water or getting things from the fridge. All those things are previously we used to think, but nowadays it is possible. Okay, so all these kind of assistive technology are there to enable the spinal cord injury people And nowadays, because of these assistive technology, they can do almost most of the things, which in fact in fact uh, more than many things which even the enabled people are not able to do. So because of this, I can say that you need to just, if you are aware of all these technologies and what all are available in the market, you will be able to help more to any spinal patient, because you can tell them about what all things they can do, what all things they can learn, and what all things are available which can make them more independent. So this slide is very important, and I hope you understand the importance of it, that you need to know about all the assistive technology, as many as possible. By you can go on the internet and find what all assistive technologies are there. And nowadays, many, like in the COVID-19 situation, many new things have come which are more helpful, like telemedicine is there. So you can have a machine through which you can directly talk to the GP. The GP can assess you, GP can provide you more medication, or is able to measure your blood pressure and everything online. Okay, telerehabilitation is there, which can help you to know about what all things you can do online with the help of nurse or carer or family member who is sitting somewhere else. Okay, so all these things are there for the spinal people, and as a carer or as a family member, if you know all about all those things, you will be able to help the person in much better manner, and it's going to be helpful for you also, because it will, and if you enable the person by telling them what all they can do, your task will be reduced. As you can see, like in my case, I hardly disturb the carers uh, for asking anything, because I can call them online. I'm able to uh, I call my laptop as a window to the world. So even though I am paralyzed neck down, I'm still able to browse the internet. I'm able to talk to my parents, family members on my own. I don't need the help of carers. Okay, so please try to learn about what all assistive technologies are available. You can learn through browsing or finding on your own, and you can also learn about it from your peers or even from the patient if they are technical. Okay, can we go to the next slide, please? Now coming to the description about in this slide, I have tried to capture like what all research and developments are happening to help the SCI patient in getting enabled or to cure the spinal cord injury. Okay, so you can see I have mentioned a lot of things, out of which a lot of research is going on to cure the spinal cord injury. And some of those things I have mentioned, like people are trying to, you know, do a lot of things which can help you in preventing uh, preventing in a way that, let's say, if someone has got the injury as T1 level, okay, so if they are aware of, and there are surgeries and all possible to make them progress above the T1 level, because if they don't take care properly, there are chances that his level of injury can go higher. And the more it goes higher, the problem will be more for the spinal patient. So there are research going on. There are some drug treatments people are trying, which can, like which can help the nerve to grow. Actually, you can see that in humans, the bones can be regenerated. Bones can join with each other easily. But the nerves, the spinal cords, we call them nerves, they can't be regenerated. And that's the reason, like once the nerves are chopped off, people cannot get it back. However, the scientists or the researchers, doctors are researching so that they can uh, regrow, regrow the nerves and try them to join again so that the spinal patient can start walking and doing all those things again. Decompression surgeries are there for those in which, like a person get injured, but his spinal cord are just compressed by the bone. They are not chopped off. So in that case, they can do surgery and move the bone a little away so that the decompression on the cord can be removed and people can start walking again. Okay. Similarly, nerve cell transplantation are being tried in which people are trying to use stem cell therapy to regrow the nerves so that they can grow and join together again and people can get the sensation and movement again. Electrical stimulation is there in which people are trying, and recently some researchers has got a good success in that. So what they have done is they have implanted a chip in the person head, and then they have implanted the other part of the chip below the level of the injury. So what they are able to do is that chip on the top is able to help the person to give instruction to the bottom chip saying that I need to walk. So when they say that, the top chip on the head stimulates and give instruction to the chip which is at the bottom of the injury level, and they can start moving. They have found recently they found very good success in that, and they managed to make one person walk again. So in that person, what's happening is the chip on the head, which is implanted, that is able to stimulate the nerve in the brain, and whatever message the brain sends, they are able to send that message below the injury level. Okay, so it's like a bridge, where the cord is disconnected. So one chip is there above the injury and one chip is there below the injury, and they are able to send the signal through Wi-Fi and are able to send the signal which can help the person to walk again. So little success has been achieved in that, and in future many companies are working in that. One of the company is named Neuralink, which is like started by Elon Musk, and their main goal is to do the same thing, like put the chip in the head, which can identify the signal and which can transfer the signal from the brain to the lower part of the body, which is under the injury. And another thing what they wanted to achieve is like there are some disease, or you can say some problems in which like people gets paralyzed or gets very difficult time, like Parkinson, multiple sclerosis, Alzheimer, all those kind of disease. They are trying to the identify them in the starting stage itself using the chip which they have implanted in the head. So if they find any kind of those things getting started in the brain, then they try to cure them in the initial stage itself, so the people won't get things like Alzheimer or Parkinson and this kind of thing. So they will be able to provide the medication in the starting itself, so that they can cure, they can regenerate the cells which are dead, and then the person won't be able to get the Parkinson and other kind of disease. So all these things are getting tried, and they are trying very hard nowadays, and there are chances that they will get success, and people like me and even the people with higher level of injury, they will be able to walk again, and they will be able to do whatever they used to do before the injury. Okay, can you go to the next slide? In this slide, I have tried to capture a video. There is a video which explains about how the person, sorry, the person needs to be taken care of once they get the spinal cord injury. So in this video, they show that as soon as the person gets spinal cord injury, they will be they need to be stabilized by the paramedics, and their neck and whole body needs to be stabilized and taken with the helicopter to the hospital as soon as possible, so that if there is any chances of recovery, then they can be recovered. Okay, so this video shows you how to stabilize and how they take you to the hospital as soon as possible, and how the doctor check you taking the MRI and other things, and find out whatever chances of recovery, and they do the surgery accordingly. Okay, this video will be there. I will send this video and other things once once we have the email of all of you on the attendance sheet. Did I give you the attendance sheet? Please fill it up. Please pass it on to everyone, so that I will be able to pass on this video and other things. Can you go down? Can you go to the next place? So in the next place, I have tried to capture some of the websites which provides lot of help about the spinal cord injury, and you can see various names, and they provide different things, like the one at the second last, spinal injury 101. They provide videos about lot of things, like what all things you can do after getting into the spinal cord injury. Okay, these are backed up by very good-hearted people, like, you know, Reeve, who was injured, and who used to do who was who has done the movies like the Spider-Man and all, but unfortunately they get spinal cord injury while they were skiing on the snow. So they also get spinal cord injury, and they have donated lot of money to make it possible that people do all the possible research and thing, so that something can be done about this. Can you go to the next? So all these websites are there. I will provide you the link about it. So if the recording goes well, I will provide you the link about the recording also, by uploading them today or tomorrow. Okay. In this slide, I wanted to say to all the people who has got spinal cord injury, and I want carer also to say all these things to the spinal cord person to motivate them. You can say to the spinal cord people that when something bad happens to you, it's true for the normal person also. When something bad happens to you, you have three choices. You can either let it define you, or you can let it destroy you, or you can let it strengthen you. So it all depends from the person to person. If you inspire them, they will even the people with spinal cord injury and very less sensation can do miracles, and can help even the normal person in so many different ways that you can't imagine. I will show you some examples which got spinal cord injury, but they have still done so well that they have done lot of things for the humanity. Also, you need to say this to the patients. Give me a second. So you need to prove it to the patient that nothing is impossible. There are lots of technology and lots of helping people are there which are ready to help you through charities and through lot of information to prove that nothing is impossible. It's just the person who needs to motivate the spinal people that everything is possible, and they just need to believe in themselves, and they need to know about the technology and various other ways of getting everything. So if you, as a carer, as a nurse, and as a family member, if you can motivate them by telling about various ways of uh, you know doing things which can enable them, then everything is possible, and the person would be able to do lot of things. Similarly, I have written that there are few things that one should always remember, which are that you are the only one who can help yourself. So you need to tell the patient, and the patient need to believe that you are the one who can help yourself. You need to strengthen yourself, give yourself that boost, that motivation, which will ease the pain and which can make many things possible, irrespective of getting into spinal cord injury. Okay, you need to tell them that never overlook your capability. You are the best version of yourself. You need to tell the patient that you are still the best. You can do miracle. You have still options. You still have lot of help and lot of technology which is available, which can enable you, and you can still do things which can help you to achieve all your goals. You can achieve all your dreams still, even after getting the spinal cord injury. You need to do things that cheer you up, that cheer the patient up, that help them in celebrating all the small wins. Like uh, if you win, if you do a small thing and if you get success, celebrate that okay, I'm able to control my laptop now. I'm able to do my like a lot of things. I'm able to control my wheelchair. I'm able to go out on my own. All those things you need to show them. You need to make them capable that everything is possible. You need to do things that cheer you up, that celebrates your small win. All these things you need to talk about. You need to show the patient that everything is still possible. You need to tell that you are not disabled. You are not disabled, but you are especially able, So once you keep telling about it to the patient that you are not disabled and you are specially able and you can do miracle. There are a lot of things which are possible, which can which you can do, then every patient will be able to do miracles. I will show you how people do miracles and have done so many things which people are surprised to know that how can they do all those things. Can you go to the next place, please? These are the examples, these are the pictures of the people who have proved that irrespective of spinal cord injury, irrespective of, disability, they have been able to achieve so many things in their life, and they have proved everyone wrong, saying that irrespective of paralysis, irrespective of so many things which we are not able to do, and they, irrespective of all the odds, they are able to do things which even the normal people are not able to do. For example, Christopher Reeve, he was the person who got spinal cord injury. He was the one who has made the movies like Spider-Man, but he got injury during skiing. And irrespective of getting the injury, even after injury, he has been able to do so well. He has been able to inspire people, and he has able to prove the people that disability is not the end of the life. You can do a lot even after the disability. You can see Nick. He was born without the hands and without the legs, but still he has proved that all the odds, whatever people say that he is not able to do, he has taken it as a challenge and have proved that people wrong. He has showed people he can swim. He can show people that he can do a lot of things which people can't even imagine. Think of diving in the swimming pool and doing the swimming and coming out of the swimming pool. All those things, it's all depends in the strength of the mind, you know. If you are strong in the mind, if you decide to prove something, if you decide that I can do anything, if you make the person, if you motivate the person and inspire them that you also can do things, then anything can be possible. You can see the third, that's a girl from India who is paraplegic, but she have proved she has participated in Olympics, Paralympics, and she proved everyone wrong by getting the gold medals in the Paralympics. You can see Spurs, who has issues with his bone, you know. He has the problem that every now and then his bone keeps breaking. Irrespective of that, this child has achieved so many things. He has become a motivational speaker. He is a songwriter. He sings the song. He has done so many things to prove that irrespective of injury, we can do lot of things. So all these things, my point of telling all those things to you is, please remember all those things and use this knowledge to motivate the person, to keep them active, to take them outside, and like make them believe that this is not the end of the life. Still, lot of things can be done. You can see Stephen Hawking. He was having the same injury as mine. Like below neck, he was not having any any sensation and movement. But see what he has done. He has written books. He have proved. He have discussed about the galaxies. He have written about the galaxies. Like he has told that other than Earth and things, there are so many lot of uh, what you can say places in the galaxy which which are there in the galaxy, and which you can discover, and there are a lot of things available in those things. And because of this, Now we are able to explore the sun. People like countries have managed to send their satellites, which have helped people. And nowadays you can see you are able to use very high speed internet because of the satellites which have been launched in the sky. So all these people have done achieved. The last one I put my picture because I have also not given up after the injury, and I have been trying to do as many things as possible uh, to share something. I have a website and Facebook page through which I'm helping people free of cost related to website designing, related to spinal cord injury, related to other injuries, related to I inspire people, uh, many people who message me from various different countries, and lot of things I am doing to uh, to make best use of whatever I am left with. Okay, so all these things you can share with the other people who are newly injured or who are spinal patients. You can help them to come out of depression, to come out of their low mood, and show them that, see, if this guy can do, if these people can do, why can't you? You also can do it. With your inspiration and motivation, you can completely change the life of the spinal cord person and make them live a life which is in which they can do miracles. They not only help you, but they can help the world in many better to make them many better things. As you can see, I'm trying to uh, do today that providing the training and trying to share my knowledge as much as possible in a way that you all also can get the knowledge and you can use them uh, while taking care of the spinal people. So I hope whatever I have discussed that might have inspired you and spread that might have given you the knowledge using which you can you will be able to help the spinal people in a much better manner. Okay, can we go to the next slide, please? Sorry, I am speaking slow because my blood pressure is not helping me, but we are almost on the last slide. So let me, this slide I have made for the carers, for the family members, and to make them aware that some carers come and the spinal cord people try to choose from them, try to talk, try to inspire them, but some of the people are not able to do things, but they say we are experts and I can do things. So to answer them, to test their capability, and to make them to convince them, here is the list which I have created to tell you about. There is a concept of expert carers or expert patient. So expert patient is someone who has learned over the time and who is capable of telling their carers about how to do things and what all things needs to be done in what manner. Similarly, expert carer is someone who knows all those things. So to start with, they should know about the spinal cord injury. So what is spinal cord injury? All the things which I have shared in this website, in this training, like what is spinal cord injury, different levels of it, how it is caused, how we can prevent them, how to deal with various things like, bowel care and other so many things. So they should know about spinal cord injury. Secondly, they should be aware of all the risks involved. which I have described, and there might be some more, but I try to put as much as possible. So they should be aware of all the risk involved and how to manage and resolve them. So for example, I told you all about like if someone is getting autonomic dysreflexia or high blood pressure, then what all things you need to see. You need to check quickly like what's causing it, and you need to resolve it by sitting them up. All those things which I have discussed in the slide where I have described about autonomic dysreflexia and how to manage it. So you should be knowing all those things. Similarly, you should be, this is very important, guys. You should, every carer and family member, they must be open to learn. They should be proactive. They should not panic by looking at the situation. They should be calm, and they should be able to take quick decision, because sometimes spinal cord injury doesn't give you the time. So in many times, especially in the case when the people go from bed to the chair, okay, what happens is whenever they go in the sitting position, whether it is in the bed or in the wheelchair, their blood pressure goes down. So remember two things I told you about: hypotension and hypertension. So to make it easy for you, hypotension happens when the person goes in the sitting position. Okay. So whenever the person goes in the sitting position, their blood pressure goes down. Okay. So you need to remember this. So hypotension or the blood pressure goes down. That happens whenever the patient goes into the sitting position. So in that, what you need to do is the moment you see blood pressure is low, try to raise the person's leg, and if you can profile his chair, try to lean him down. Try to, recline the chair if the chair supports that. If it's a manual wheelchair, and then you need to tilt the wheelchair. You should know about how to tilt the wheelchair, and one person should raise the legs up. So that's the first step you need to take. If the wheelchair, like my wheelchair supports reclining and tilting back and raising the legs up. So in those kind of things, you need to know about everything about the person's wheelchair. So whether it's a manual wheelchair or a normal or a electric wheelchair, that's very important that you know about it. So I put that in the points that they should be aware of and try to do things as per the preferred routine of the patient, because that helps the patient to plan his day. Okay, what happens is, like in my case, I always want to, get up early in the chair so that I can do lot of things like getting involved in the activities, going out, or talking with the other person. But what happens if they are doing someone else who doesn't want to go up early, but they just go and do someone else and get them early, irrespective of the patient doesn't want to get up, then that sometimes upset the people like me, that why I'm not getting, you are not able to get me up early, because if you get me up early, I can plan my day. So try to prefer the routine. Okay. You need to learn about time management so that uh, you can manage the time of whatever whatever patients you are doing. Okay, whosoever wants to get the early, try to get them early. If someone wants to get up later, then try to accommodate their preferred plan. That makes them happy. The next is very important, as I already told you, that the carer should know about the maneuvering of patient wheelchair. So whether it's a manual wheelchair or electric wheelchair, the carer should be aware of all the functionality and what to do with the wheelchair in different circumstances. Okay, so I already told you if it's a hypotension, like the blood pressure is down, you need you need to tilt the chair back. So if it's a manual chair, you can tilt the chair back by using your force, and one person needs to raise the legs up. That should be the first thing. If it's an electric wheelchair, you should know if they have the this feature in there to tilt, recline, and raise the legs. Then you should know very well about how to do it, how to operate the wheelchair. So this is very important, okay? When you learn about the patient, learn about his wheelchair also. The next one is the person should be well versed in safeguarding rules and perform the safe and proper moving and handling. Okay, so you should be aware of using the sling and putting it in straight and how to put it back and all those things without doing any mistake and without panicking about anything. Similarly, good knowledge of profiling the bed making in the sense like no wrinkle should be there in the sheet. Types of sling you should be aware of because sometimes there are different kind of sling. So don't get confused. You should be aware of all those different kind of sling, and you should be aware of proper use of slide sheet and handling of various type of hoist. The proper use of the slide sheet and profiling of the bed, these two are made to save your back. Okay, so it's not for the patient. If you use the slide sheet properly and if you profile the bed like you know how it should be, like the rule says that it should it should be high enough to reach the height of the waist of the shorter person. So if you do that and if you use slide sheet properly, you won't get the back pain so easily. So these two are made for the carers. You should know about it. If not known, then you need to ask the nurse or you need to ask the question to the during the training. Even the patient can help you. Like I always make sure to help people in knowing about it. And I have told about, I found a lot of people not using the slide sheet properly. And I have told them, and many of them are doing very well now. Next one is you should be well aware of all the steps for safe and proper personal care. Like you need to shower, so you need to hoist the person in the shower. If they get hypotension, then what need to do? You need to you need to take care of all the skin and do the care in a way that people should not get any pain and get the hypertension. So all those things also you should be aware of. You need to be aware of things like rehabilitation, which consists of doing the exercises and keeping that and doing the stretches so the person still stay active and will be helpful to him in case there is cure there. As I told you, recently one person has started working after the implant in the head and the another chip at the bottom level. So just in case if that kind of cure is available, even I might be able to walk someday. But for those days, you need to help the patient by keep doing exercises so the joints of the leg and hand won't get stiff. Similarly, you need to reposition, timely reposition to save the skin. Body mapping needs to be done every time. So you need to monitor the, the skin and you should be aware of likes and dislikes of the patient. Sorry. So if you know the likes and dislike of the patient, try to do it in according to his likes, because that will save a lot of time from arguing, and you will be able to help the patient in better manner to achieve lot of goals and things. Okay. Next one is, you should be regularly monitoring the skin. So whenever you go in the chair, you come out of the chair, you reposition, or all those things, you should be aware of the skin problems, and you should monitor the skin, and also know about how to put various splints like leg splints and hand splints to to help the patient. Similarly, the carer or the family member should always keep the surrounding tidy and hygienic, and it keeps the patient happy, because many people, they just put, while doing the patient, they just put everything here and there. They don't refill the things. All those things, create lot of mental depression, mental disturbance also. So it's very easy for you guys to help them, help each other actually, by putting the things in the proper place and by refilling the things, so that, like, if NCO sheet is finished, and when NCO sheet is required, you don't need to find those things in the storage and come back and do all the things. So try to refill everything on the timely basis. Whichever you are working with, it's your duty to refill everything and to take care of everything, and listen to the patient. And if you learn something new, you can put it and let the others know that if you do it in this way, then it will be more fruitful. Okay. So I have already said about surrounding tidy hygienic. If the person is in a care home, then I already said that keep sharing their knowledge with others who don't know. By doing that, you are making your life easy, and you are making others' life easy. Because if you share with each other, you will become professional, and you will become more informed, and you will be able to help the patient and other people in more better way. Okay. So be aware of all the things. Also, should not hesitate in asking question. Okay. The more, wherever you get any doubt, please ask the question, why it is there, why we are doing like this, how we should do it. Because unless you ask those questions, you won't be able to get the answer, and you will keep the doubt inside. So be stupid in the first time instead of staying stupid for the long time. Okay. Ask question. And what I have realized is, if you ask the question like why we are doing it or how should we do it, and if you understand the logic about why we are doing it, then you don't need to remember. You will remember it automatically for a long time, because people will say that we are repositioning him to make it, to save him from the skin problem. So once you know that why you are doing things, you will do it religiously, because you don't want to put your carer, your patient or your brothers or sister in a problematic situation. Similarly, I have written that always remember that patient knows his body better than anyone. So always remember whatever the patient is telling you, listen it very carefully, and try to give it priority. Then if he is saying something, then please listen to him because the patient knows his body better than anyone else. Every patient's body is different, and it's the patient who will be able to help you by telling you that what's the better way of doing, helping him or taking care of him. So understand him and don't allow your ego to come in between saying that, oh, you do need to tell, I have been working as a carer on 30 years or 20 years. Because whenever someone do mistake and they say these things to me, like I have been working, I know about it from 20 years, I straight away say, I am very straightforward person. And I immediately say to that person that, oh, if this is your attitude, then I don't know how many people have suffered till now and how many will suffer more in the future if you don't change your attitude. Okay, so guys, please be open, be a lifelong learner. And that's the reason I have put the last one, that be hungry to become a better version of yourself every moment and every day. Every day there is a lot of things to learn. So keep learning. By learning only, by sharing the knowledge, whatever you know, by sharing with each other, you will become a better person very quickly. If you hide, if you put it on your ego, if you don't, you say things like, oh, I know, you know, that means you have stopped learning and then you won't be able to help much. So be hungry to become a better version of yourself every moment and every day. Take it like a quotation and try to become better version of yourself every moment and every day by learning new things. Okay, with every person, like even with every spinal person, you will learn different things because they are different. Even though they have same level of injury, but still you will find they are different in strength, they are different in many ways. So learn about it, be open to learn. Okay, can you go down, please? Okay, so that's all I have to say. And I want each one of you to take the picture of it, okay, in your phone if you can, because I have put some QR code. So these QR code will help you in accessing three things. First one will be, I will try to put the recording of this session online, and you will be able to access this through the QR code. Okay, and you will be able to learn more about health related videos by accessing the first QR code. So the first QR code will take you to the website of mine, which calls disabledhelpers.org, through which I am trying to help as many people as possible about the spinal cord injury, about various other health situations, and about various health related issues. So you can see, like, my goal of I created that website to prove that we disabled person also can help other people in bringing the change in the society, because my objective was that lot of people, spinal people, get spinal cord injury and they were having lot of knowledge about lots of things, like for example, say someone was lawyer, someone was a teacher, someone was a surgeon, someone was a professor. So they all have lots of knowledge, and then my goal was to bring all of them at one place so that they will be able to help other people, other able people, and in a way that to prove that we spinal people are also able to help in bringing lot of change in the society and we are still able to share lot of things, lot of knowledge which we have learned over the time. Okay. The second QR code is about the attendance sheet. So I have given the attendance sheet for the people who are here, but I still request everyone to go through the attendance sheet and try to put your contact details, yeah, like whatever is there, it's editable. So try to add all your contact details so that later I will be able to share more things uh, whenever I find something that would be helpful for you to take care of the spinal patient. And last one is the I told you about it in the starting that be attentive. I will be taking an assessment thing, all of you. So I have put an assessment sheet over there. Just download that and try to answer as many questions as possible and submit them. You can attach as many sheets as possible, or you can answer directly into the Word document. Like, first page is the questionnaire, so you can type the answer in the second, third, fourth page. I won't mind, okay? So you can type in a separate Word document and submit it. That will help me in understanding about how I have done, what all things I was able to explain to you guys, and what all things you managed to understand, and what level I feel that you are capable of uh, to to take care of the spinal patient after this training. So I request you to please download that assessment sheet and please answer all the questions in as much detail as possible and submit that those answers and the assessment sheet with your name, designation, and if possible, email address also, and submit them to the nurses here. Or if you are working here, submit it to me so that I can go through them. That's going to really help me and is also going to help you to assess yourself about what all things you learned and what all things uh, now you are able to do and what all up to what level you are able to take any spinal cord person, not only just me. So I request you to take all these QR codes and help yourself and please try to help us also. Help us means like help uh, not only me but the training department of our Kingfisher so that we understand how we are doing and how we can help you more about everything. We can do more different uh, different sessions also about more different, problems which are people are facing like tracheostomy, epilepsy, and all those things. If you like these kind of uh, training session, can we go to the next? I hope everyone has uh, taken the picture of that, so you can get. If you are not able to take the picture, please you can email that to me, email to Lee or email to me, and I will be able to send the QR code again to you. I'm really thankful to all of you for your patience and for attending this session. Uh, I have put a lot of efforts and I have tried to touch base on as many things as possible. I cannot, I was not able to explain everything in detail because some of the things like bladder, bowel movement, and other things require a separate session, and those are for nurses also. So if required, we can do it some other day. Please mention about it if you guys are interested in making me, and if you want me to make more elaborated video about ball care and bladder, and in fact, I request you to find yourself about it, because that way I will be able to find how much you have put your effort, how much really you are interested in helping. And this will show whether you are coming here just for earning the money, or whether you are coming here specifically to help the people who really needs your help. So I thank you again from the bottom of my soul for attending this session. Now I am open for the question and answer. So guys, one by one, whatever question you have, please ask them. Anyone?
Everything, I think everyone's.
I try to cover as many things as possible, but still, if someone has question, please answer at least few questions here. And even later, if you have more questions, please send the email and I will try, and even Lee, send it to Lee. We will try to answer and try to explain everything in as much detail as possible. I remember Young was asking one question. Young, can you ask your question? Young,
I have lots of questions.
okay, ask please. I'll try.
Maybe I ask you maybe later, okay? When
Yeah,
I
that's
work.
fine. That's
Yeah,
fine. Yeah,
yeah,
I'm
yeah.
okay with that.
Mm,
Yeah, it's good that you noted down the question.
mm.
Yeah. So, guys, at least ask few questions on this session. That will make me feel that you guys have really listened and understood my voice, because it's not that good. It's not that melodious voice. And I really feel thank you that you have attended it without going to sleep. So, yeah, ask some question if you have really gone through what I have said, and I'm sure you must be having some, at least ask 4 questions. Any one of you? No questions?
I think
That
everyone.
that tells that either you guys did not understand anything, or you have understood everything too much. Anyway, as I told you, I will be available. Lee will be available anytime for any question. So fire as many questions as possible through your email. And I already told you the email address. You can you go one step up, page up, number 9. No, go number 9. No, go down one. Yeah, wait. No, yeah. So I have opened this slide again so that all of you can take the picture. Our email is there, or you can directly email to Lee, and then you can take the QR code so that you know you will be able to find whatever we have discussed and other things. So I think I need to stop here. I am again thankful to all of you from the bottom of my heart, and I strongly feel that this is going to help you. And with this knowledge, you are not only going to help the current spinal people who are here, like me, Paul, and others, and you will be able to improve and ask more questions. And please, guys, keep sharing your knowledge with each other, because that will help in training other people as quickly as possible. And that way, we spinal cord people will not be dependent on very few people. Because if everyone is trained and everyone is able to do things, then the task becomes simple very simple for not only the management and nurses, but for the patient also, because he doesn't need to choose and he doesn't need to look like a devil while asking, like he won't be looking like a more demanding person. So again, thanks. Can you stop the recording, please? So